At the end of the day, it's probably the case that what HCCI's Price Transparency Initiative will do will alter the way that providers sell services. Since we're providing prices with respect to particular care paths and steps along the care path, consumers are going to be approaching providers and say, this is an estimate of what I believe these sets of services should cost, and they'll be looking for providers to turn back to them and say, we're willing to provide that set of services, that bundle, for a particular price. So it changes the notion that providers will be selling services by CPT codes to selling services by bundles, and it will allow consumers and providers to be talking a common language around the bundles. I think the most interesting result that we found over the last 2.5 years is the fact that while everybody understands that healthcare spending goes up as people age, and we find the highest spending among the Medicare population, the most surprising result that we found is that the individuals with the fastest growth rate from the lowest base are kids. Basically, we have kids, a generation of unhealthy kids whose spending is growing very, very rapidly. And if we want to ever bend the long-run cost curve, we've got to deal with kids' health. If that cohort is sicker than each preceding generation, we'll never bend the long-run cost curve. Basically, at the end of the day, we're not an advocacy institution. We're putting the data out into the public domain, and what healthcare leaders, politicians, community stakeholders are able to do is ask the question why. Historically, we never had data that would be granular enough to answer the question, why are emergency room rates potentially going up at faster rates than other services, not to pick on hospitals, but or particular specialty practices seeing faster growth rate. We now have very granular information that allows both hospital administrators and others to ask, why are our prices going up faster than our competitors or the state average or another institutional setting, and ask the stakeholders within their own institutions the question why.